Hey Tina, it's Ryan. This is video D for the shoulder exam of upper extremities. And first thing we're gonna do is we're gonna do AC instability. So our first test is going to be the O'Brien's test. So I'm gonna have my patient here, which is Emily, and she's gonna come out here. And I'm going to have her flex her arm to about 90 degrees. And then I'm going to horizontally adduct AD to about 10 degrees. And then I'm going to maximally internally rotate, like so. And then from here, I'm going to resist elevation by pressing down with a downward force. And I'm gonna have her push up against it. Perfect. And then I'm gonna have her flip her hand around for external rotation, and I'm gonna have her repeat the same. So I'm gonna resist this elevation. Good. If there is increased pain with internal rotation of that test and decreased pain during external rotation of that test, then that's a positive sign or positive test, and that could be indicative of a AC injury. Next thing we're going to do is the compression test. So I'm going to have the patient sitting for this one, and I'm going to flex her arm to 90 degrees, and I'm going to have the arm like this, and I'm going to move it horizontally adducting so that the joint is compressed here. If there's increased shoulder pain, then that's a positive test, and that could also mean an AC injury. And then AC resisted extension test is going to be when sorry, let me gather my bearings. Oh yeah, I remember. So what she's gonna do is she's going to have her arm at 90 degrees flexion and about 90 degrees elbow flexion. And she's going to do a horizontal abduction force against my resistance. I'm gonna provide a resistance force. Ready, go. Very good. If there is pain or weakness, then that's indicative of a special test or a positive test, and that can be indicative of an AC injury as well. Moving on from AC instability injuries, we're going to be going on to the next part of the video, which is going to be impingement. And the first one we're going to do is the painful arc sign, so I'm going to have the patient stand up for this one. And what she's going to do is she's going to move the scapular through the plane of motion, and then she's going to raise her arms back down to her side. So can you please raise your arms like this and return them back down. Very good. If there is any pain from 60 degrees to 120 degrees, then that's indicative of a positive special test, and that could mean that there is a possible subacromial pain syndrome occurring. The next one we're going to do is the Hawkins-Kennedy test, or Kennedy impingement test. For this one, I'm going to have her seated down, and I'm going to have the arm at 90 degrees flexion, and then I'm going to internally rotate it, and I'm going to have the elbow is also 90 degrees flexion, and then I'm going to internally rotate like this. If there is any pain with that movement that I'm doing, then that's indicative of a positive test, and that could also be a possible subacromial pain syndrome. And then external lag or external rotation lag sign is the next one. So what I'm going to do is I'm going to have her in elbow 90 degrees flexion. I'm going to abduct her arm to about 20 degrees, and then I'm going to externally rotate her arm to about 5 degrees till the end point, and I'm going to have her hold this position. If she holds the position, it's a negative test. If she springs back, that's a positive test, and that could be indicative of a possible subacromial pain syndrome, or it could also mean a teres minor or infraspinatus injury, and they're together, teres minor and infraspinatus. And then external rotation strength test should be completed if there is a negative special test for external rotation lag sign test, because it can help determine strength of the infraspinatus and the teres minor. So I'm going to have the patient seated. She's already seated. And I'm going to have her elbow flexed to about 90 degrees. And then I'm going to hold her elbow like so against her body. And I'm going to provide a resistive force towards that external rotation movement, just like so. If there is pain or weakness with that movement, that's a positive test, and that could mean a teres minor and infraspinatus injury.